right. Hello, everybody. Thank you for joining us today for the ARC of Fort Bend County Parent Education Support Group on Zoom today. I'm Carrie Axtell, the Youth and Education Advocacy Program Director here at the ARC of Fort Bend County. And just a little bit about us, we're a nonprofit organization for people with intellectual and developmental disabilities known as IDD, such as autism, Down syndrome, cerebral palsy, and more. Our mission is to ensure opportunities for people with IDD and their families to maximize their quality of life within our community. We do that through advocacy for and with people with IDD, through community outreach, providing information about community services and resources that are available to families. We provide trainings, resource fairs, parent support groups, such as this one. We hold a variety of excellent social and recreational programs, such as our monthly Teen Tween Social, Parent Night Out, 20-something social group, an adult social recreation club, Special Olympics for adults, and much, much more. So if you have any questions about the ARC of Fort Bend County and what we do, I encourage you to visit our website, arcoffortbend.org, and like our Facebook page, which we will update regularly with community events and information. And right now, I'd like to spotlight our Best in the West annual fundraiser and silent auction. If you'd like to support the ARC and get a head start on your Christmas shopping, we have some amazing gift baskets, jewelry, toys, vacation packages. There's a barbecue pit raffle, tickets to shows and museums, and much more. You would just visit bestinthewest.givesmart.com. And you can also reach out to me, and I've put all that information in the chat box for you. But if this is your first time joining us, welcome. You're in for a treat. There's some exceptional professionals here in our community who share their knowledge and expertise with us. And we meet the second Thursday of each month throughout the school year at 11 a.m. And this month, we're very proud to welcome Wendy Maurer with Cole Health ABA Solutions. And she's going to present about the power of early intervention and parent resources. Before I introduce Wendy, just a quick announcement. When you logged on, your microphone was on mute. And that's just to help keep down on background noise so you can hear Wendy clearly. And this will be recorded, and the presentation will be shared on our Facebook page and YouTube channel later on, because we always have, of course, a couple of parents who can't make it day of. So we provide this as a resource later on. If you have a question during the presentation, post it in the chat box, and I will communicate that with Wendy so that your questions are welcome throughout. If a question pops up, type it in the chat box, and I will tell Wendy about that. The button for the chat box should be located near the bottom of your screen. And again, I'll compile those questions. And thank you for asking them, because usually you guys ask some really excellent questions, and that really helps the conversation. As some of you may know, this group has a dual purpose. The presentation is first at 11 a.m. and then at noon, after I stop the recording, Wendy will continue to take questions if you have them. And then we also have a support group. If you ever want to talk and chat, we kind of hang out and chat afterwards. So you're welcome to do that. As always, if you have questions and you want to discuss it offline with me one-on-one, you can shoot me an email. My email is kaxtell@arcoffortbend.org. And again, that's in the chat box. But without further ado, I would like to introduce Wendy Maurer with Cole Health ABA Solutions. She's going to share her inspirational journey in working with children with autism, and then she reversed roles and became a parent herself of a child with disabilities. Through early intervention, she has seen key foundational tools made accessible to her child, and she advocates for early intervention and parent training. Wendy provides a remarkable wealth of resources to families to gain access to free tools and programs within the community and statewide. As part of your registration today, you will receive an email with digital copies and links to all programs that Wendy discusses today. So as Wendy says, don't desire, be inspired. So don't worry, you're going to get some goodies after this presentation later on this afternoon. I'll shoot that email to you. Wendy is a passionate professional who enjoys telling her journey of early intervention and the great effects it can make for all families and children with disabilities. She has experience in the field of public education from being a former special education teacher and behavioral specialist for over 10 years. She left public education to join Cole Health as she believes in the power of earlier intervention. She's an active member in the greater Houston area, community, and statewide with her leadership in the Disability Advocacy Network. She has created ABA training programs with providers and ongoing training with Baylor College of Medicine residents while working at her favorite place, Cole Academy. Wendy holds her master's degree in special education with an emphasis in applied behavior analysis from Texas A&M University, and she has formal training in ABA towards her fieldwork hours. She has worked alongside Texas state legislatures in creating several House bills to advance the training programs in public education for children with disabilities, and is an active advocate with several organizations in creating systems change within the state law. She's a graduate of the Texas Council of Developmental Disabilities, Partners in Policymaking, and serves on the National Council for Learning Disabilities, Texas Parent Stakeholder. Wendy has also created and still operates a nonprofit organization, Eagle Pass Heroes, for families in the rural community of Maverick County, providing them with training and resources for people with disabilities. She's also active on social media with her family's journey in autism and part of That ABA Teacher. Wendy is married to her barbecue-loving Aggie husband that is an amazing supporter of her dreams and has a serious problem with telling his wife no to anything. What we wish we all had that problem, Wendy. And they have a beautiful son who I learned is now 7 years old in second grade. And he's thriving with autism, ADHD, and sensory processing disorder. And when she isn't working, she enjoys spending time with her family, laying out on the beach, traveling across Texas, and back porch time with friends. It is my pleasure to introduce Wendy Maurer.
I think that was the longest introduction I've ever had. I didn't realize that, but it was really nice. I was like, yeah, that sounds interesting. So, but now you guys can know a little bit about me. But I'm really happy to be with each of you today and just share a story of my journey that really is a common journey that many of us take as parents. And so I'm really happy just to go over all this with you. I think you've already learned enough about me, and just know that this presentation isn't about me. It's about us as parents and how we take our journey and how we take early intervention and create that for each of us. So I'm a huge visual person. And so the picture on the left is me when I first started my journey. I was a special education teacher in Eagle Pass, Texas, in a self-contained classroom that was labeled as a life skills unit. And I ended my teaching career as a co-teacher and behavior specialist in middle school. So I've had quite the gamut of experiences in special education and really learned so much along my journey, mostly through the best teachers in this world, which were my students. My students inspired me to go and get my master's degree and really taught me to open the doors and know that the base education that I had at undergrad school wasn't enough to help reach them and their abilities. And so receiving my master's and learning about ABA and implementing ABA in public education really helped elevate my students within their success. So when we talk about early intervention, really early identification is what we look at. So speaking in pictures, these are two very powerful pictures to me as a parent. So the picture on the right is my son when he first received his diagnosis at age 2 for autism. I didn't have the best experience from our rural community, even getting a referral in to get that diagnosis done. I had to advocate for that because he was a boy and I should give him more time, and it's just a speech delay, right? But I knew as a special education teacher, he was having all the signs of autism. I found myself saying things to my provider, and as the words were coming out of my mouth, I was breaking down in tears because I realized the things that I was communicating were the exact same things that my parents of my students that I had communicated to me. And I made that connection, and I knew that I had to get early identification to get access to services. The picture on the right is our son after we moved to the Houston area and seeking out more services. Us being in Eagle Pass, Texas, which is down on the border, we had no services there. We had to heavily rely on the school district, and we knew that our son required more intensive. We were looking into medical treatment and with ABA therapy, speech therapy, and occupational therapy that could be more customized and to fit his needs and growth. So we moved 6 hours across the state of Texas, and coming into Houston was a whole different ball game because you have so many resources that you can find. And I've been very blessed to have the best support network and team. And so the picture on the left is our son. The picture on the, sorry, I'm jumping around. The picture on the right is when Carter was diagnosed at age 2 in San Antonio at Autism Community Network. And he was diagnosed with the autism level 1, which is the autism level 3, excuse me, with the most severe autism requiring the most supports. And then the picture on the left is 2 years after he started ABA therapy treatment, and he was re-diagnosed with the autism level 1. And that growth between the levels really was because of the early intervention model that we had through ABA therapy and through parent training that we did at home with our child. And so going through the course of time, starting my journey off as a special education teacher, I really wanted to make a difference. And I really didn't know that I eventually would be a parent of a child with a disability. So I actually feel like I have the best training when it comes to that because I learned through my child, but I know so much through so many other parents. And so I think the biggest resource I've ever received as a parent is just networking with other parents. And so finding your tribe and finding your people is really critical when it comes to having access to services and resources. So this is just my son Carter throughout the years. This is Carter's now in the 2nd grade. He's thriving in a general education classroom with no pull-out supports and minimal supports and accommodations in a gen ed classroom. This speaks volumes to me because our child was labeled with a severe disability where unfortunately, it's illegal to have, certain deficits drive placement for your child. But my son was placed into a restricted autism unit, life skills unit when he started his educational journey. And I wanted more for him. And we wanted him to be involved in an inclusive community setting. And I knew that that would start in a general education classroom for him. And so for us to get him there, that's why we decided to pull out for a couple of years and do ABA therapy. And it was just incredible. Our son entering in ABA therapy being completely nonverbal, massive maladaptive behaviors, and to where he graduated after 2 years and had left with a speech. It just really speaks volumes on what early intervention can do for children. And now my son won't shut up. And so he prompts and redirects us. And, thank you, Amazon, for sending that guidebook wish list because every day he's coming up telling us what he wants for Christmas. So, but these are things that I never thought that our son would do. And really, because the whole glimpse of hope when it comes to disabilities and autism, even my first providers that I had in my network didn't give me the great outlook on things that he could do eventually. So I was very limited on what I thought he could do. And he proved everybody wrong just by being the wonderful kid that he is. And he is just the best self advocate for himself now. So I consistently, one of the best things about my job is that I get to connect in the community and speak to providers. And I consistently always tell providers and residents this, that when you're diagnosing a child, and when I use the word autism, I really mean all disabilities. But when you're diagnosing a child with a disabilities, you're not just diagnosing that one child, you're diagnosing that whole family. And so what does that look like? What is the plan of care for the child? What does the plan of care look like for the parents, for the siblings, for the grandmas, the grandpas, the teachers? And so leaving an IEP meeting empty-handed, finding out a diagnosis, or leaving a doctor's office empty-handed without resources and materials really should be a thing of the past. And so having these resources readily available and knowing that there's support around you is critical and can really help you and your child. And so this picture, again, because I'm big on pictures, that in order to change the behavior of a child, you must change the behavior of a parent, you know? And so this is so true. And this picture means so much to me. This is our son. I used to always speak for him. For us as parents, we always feel like, well, I know what he wants or I know what she wants. And we have to let go of that because we have to have our children make their own choices in life, whether they're verbal or nonverbal. And so our son first opened up on his language with Pecs. And so this is when we were at Chick-fil-A and broke down to mama tears here because for the first time, I always ordered him apple juice, thinking that he loved apple juice. But on his own, he communicated that he wanted milk with his meal. And for me as a parent, hearing that from him, knowing that he made that choice for himself, just spoke volumes for me. And I knew from there on that we're definitely going to have this kid thriving on hand, you know. And so giving your child choices and allowing them to have that, we can't limit our kids and put those, you know, well, he's not going to be able to express himself because everybody can make a choice in some way or another. So now that's kind of just a little bit of background about me. I can talk all about me, but it's not about me. But I'm just really diving into resources. I know, again, it says autism, but it really is. These are great resources all in general, just to kind of go over everything. So when we speak about resources, I've broke them down in different sections and you'll be getting a copy and a link to all the resources you had today. So don't feel like you have to write them all down, but I'm actually going to take you through each website and kind of show you what they are. And these are all free, most of them based within the Houston community and statewide. And so these are really great things for you to know. This is the copy on the left is kind of what our resource guide looks like when it comes to just a PDF where it has a link that you can click on it and then a brief description on what it is. And then on the right, for families that are seeking out ABA grants or even just scholarship information for therapy and access, we also have that we're going to be sharing out today as well for you. So early intervention, when we speak about early intervention medically, when we look at it, it's from ages 0 to 7. But early intervention can happen at any age. It can happen at age 23, 27. Early intervention to me really is the first day that you find out something and you proactively take those next steps. Like, well, what are we going to do? You know? And so one of the first things, and I'm going to not click on this website. Well, actually I will, because that's what I'm here for today. So the MChat, if you haven't heard about this, it's a great pre-screening tool for parents to go to kind of privately. That way you can go, and if you ever question like, does my child have autism? I don't know. You can come to this website, and what's really great is you can click on it. You create a free account real quick, and all it is 20 questions where you go through, and it lets you know if you have elevated scores that you need to go and share with your pediatrician. And it kind of gives you that. Just a little fun fact for me as a parent, I actually took this in my home when I was questioning, does my child have autism or is it just a speech delay? I took it and he was highly elevated. So then I retook it so he didn't have it, right? So it's like a little bit in parent denial there, but it's a really great resource and tool for parents to have. The second website that I really like when it comes to early intervention and tools is this Little Texans Guide. And this is actually done through the Children's Learning Institute, which is here in Houston in the Med Center. Really great providers that we work with put this together. And I actually use this as a special education teacher to help guide me as I didn't have a curriculum in my classroom. I wanted to know, what are typical developing children doing at age 3? And what does that look like? What does that look like for social emotional? What does that look like for physical? And so really kind of diving into that. So if you come on here, you'll see that you can download any type of materials. They have different modules that you can go through and do. I like to click on this here. And the one that I like the best is just download the full guidelines in here in English. It's 94 pages. But I actually, as a teacher, would print this out, spiral coral, bind it and everything. That way I would have it. But our partners that have put this together are super awesome. You can go through it and kind of see how it lays out each foundational skills for kids. And so, and it tells you the age group as an infant, these are typical developing milestones. And as a caregiver, you can. And this is really great for parents to know too, especially if this is your first child and or your only child and you don't know, you don't have another kid to compare it to, and so just knowing what typical developing looks like. And that way, if they're not meeting those milestones, you'll have some more information. I know that when we go into our pediatrician's office at a young age, we fill out those ASQ questionnaires, and sometimes those can be brushed over real quick. And so we really want to make sure that we know what those milestones look like. So super great website and resource there. I love, 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 love this resource here. And on when it comes to early identification, I working in the medical field and working with providers. There's a lot of providers that have asked me, I don't feel comfortable telling parents about autism. I don't understand, and so there's just a lot of training that's still needing to be done. One of the providers I work close with in the Pearland area, Dr. Ebony Holler, actually worked with the CDC when she was a resident at the Texas Children's Myers Center and putting this program together. And basically, I can't seem to find it right now. That's great. But this link should be able to pull up the autism case training. I don't know why it's not pulling up. I'll send the correct link in later. But this website here provides for providers to give out free continuing education hours. So they're able to identify what are the early signs of autism, and recommendations should they be giving out when it comes to that. So it's a really great web-based course design for providers. And providers aren't the only ones that can take it. You can even take it as a parent or as a teacher. So it's super great to have that information. State services, super fun. This is our next section on just going through on what our state has to offer. So when it comes to locating services, I really like this, to the Health and Human Services will be able to go in. You can come here, come through a drop box. This is my zip code here, so I'll put that in, but you can break it down by all disabilities here, or you can even break it down by epilepsy or children's autism and see all these different options that you can also breeze through here. So when I go in and I click search, it's going to pull up all the centers that are funded in with the Health and Human Services. So for me, the closest would actually be this one here. I don't know why this one pulls up, but Tri-County Behavioral Health Services in Conroe. I can contact them and see what services they can help provide me. So if you want to know a little bit more about what they can do, you can check on that. And then this slide's supposed to be last, but so when you come to Health and Human Services as well, when you go to their website, they also have all disabilities listed off to the right. And then especially when it comes in with autism, you can look at what services are provided, who's eligible. And then they also have some resource links on, what is it that they're doing right now. We are in a very unique situation this year with the state of Texas and autism. Right now, in order to receive ABA therapy, which is typically the most recommended out treatment for an intervention for autism, that's typically funded in just by private insurances. But the state of Texas did approve last year through the House that Medicaid would be covering ABA services. That funding was supposed to be released this year, but due to COVID, it has been put on hold. To stay up to date on those updates, I follow a public policy group called TexABA, and they're really great at giving out those resources and kind of timelines on where we're at. Right now, Health and Human Services has announced that they will be meeting in March of 2021. So they'll be going over the funding and the MCOs on those. So eventually ABA clinics who are going to accept Medicaid and for ABA insurances, they are, it's still going to take some time to build those up. But for parents that do have Medicaid, I would go ahead and start touring ABA clinics, seeking out your options and see what that looks like and find that place that's going to fit your needs for your child. So Navigate Live Texas. I almost wish there was a state law on this website right here to where every provider and every parent had access to this resource. It's actually critical that once you have a child diagnosed with a disability to come on this website here. Not to throw down Texas in any way, but when you look at the state of Texas in the United States, and when it comes to disability services, Texas really does fall last on that list. One of the reasons being is if you look at states like California or Florida, where they already have funding for ABA therapy and Medicaid services, right? But state of Texas right now, when it comes to access to services, we're on a 14 to 16-year wait list. And so we have what's called interest list. So it's very critical to get to know what Navigate Live Texas is. Now, it's very confusing. So for as a teacher, when I had Blue Cross Blue Shield insurance, my income level was too high to qualify for any state services. What the Medicaid waiver interest list does is it doesn't matter what your income level is, you can be applicable into these programs that the state offers, which is great because sometimes those Medicaid base levels are so low. It's like if you even just have, teacher's pay wasn't that high, right? So like even just with that income, I didn't qualify in for my child's services, where really his services were above my pay level, right? So coming on to Navigate Live Texas, it's really easy. You come here and you're going to go to insurance and financial help, and you're going to go down here to Medicaid waivers. And I always click on the Medicaid waivers overview here. There's a super great lady that does a much better job explaining on what Medicaid waivers are than me. And basically what's very eye-opening for me as a parent is when I first saw this, I was like, wow, this is the state of Texas Health and Human Services putting out a video saying it's critical to sign up now because there's a 14-year wait list. So that speaks volumes of where we're at. And so if you're wondering what those interest lists are for, they're all listed over here, and you can kind of navigate and see what they are. As a parent, the easiest thing to do is when you scroll down here, this is the 1-800 number that you're going to call. And all you need to know is your child's disability, date of birth, social security number. They'll ask you what list you want to be put on. I say, put me on every single one that you can for us. If you don't, once your time comes up in the line and they call you and say, hey, Wendy, we have an opening for your child on the class, and let's say at that time I don't need it. I say, I'm sorry, we're not interested. The parent behind me will give me a big hug in line and say, thank you so much. And that's it. And so it's really important and critical that parents know this. I wish there was a Texas state law that it was mandated that providers had to provide this information for parents because it's critical and can save your family thousands of dollars and give your child access to services that they may need later on in life. I work with a lot of parents. They're like, oh, well, he may not need that. Well, we don't know what the world looks like in 10 years from now. Sign up and get on these lists now. Online resources. So one of my favorite online resources when it comes to, especially a lot of families that come to us that don't have ABA coverage or don't even have an autism diagnosis, right? So we have a lot of kids that may need just social skills, that may, have just some components of executive functioning or behavioral concerns or ADHD. And so without an autism diagnosis and ABA benefits, you have very limited services that you can access. But one of the great things that you can access is these state-funded grant programs. And I absolutely love Texas A&M because I'm an Aggie, but also because one of my favorite professors, Dr. Jennifer Gantz, had started this program. Coach to Communicate is super great. It's a free module. They just broke it up this year to where they have it into 2 different sections. One of them is basically self-guided parent webinar training that you put yourself through. And the other one, and this is the one that I've been through personally as a parent, is the intensive parent coaching. This is a really great program for parents. And they're actually using an ABA technique called parent-child interaction therapy. It's a 12-week program. you'll meet with a BCBA, and you'll set up 2 to 3 small parent goals that you'll have for your child. And then you can upload videos or live feed videos with your child's therapist, and they'll give you feedback on things to do. Um, this speaks volumes to me as a parent, because once I saw myself on video on the way I was implementing some instructions with my child, I realized all the things I was doing wrong. And especially having somebody else going to help coach me through that in a very positive manner, it really led to us meeting some great goals for him. So love, love, love this program. Super great. One of my favorite absolute websites is right here, and this is TSLAT. And surprisingly, it's through TEA, our Texas Education Agency. So TSLAT's awesome. Again, don't let the word autism scare you away. If you're a parent of a child with any other type of disability, this is a great resource for you to have too. So when you come on here, they hit it. It used to be up here, but now they hit it. If you scroll all the way down to the bottom when you get to this website, they have a little thing right here called resources. So if you click on that there, you'll be able to see all these great resources, evidence-based practices, general resources, all these different training sites. So these are some really great tools to have. The second best part that I like about this website is that when you click on Target, I always say click on Target because it's better than Walmart. And so when you get here, you have 2 things, and there's evaluations and interventions. Now, this is super powerful for parents to know and understand. So click on evaluations. So many times, especially through the school system, our children's are reevaluated every 3 years or upon parent request, right? And so we need to really understand what those evaluations are looking at. Are they looking at the right things? Did they complete the evaluation in full? And so as a parent, we really don't know what those evaluations are. This is where you can come and find out what those really mean. So they have categories here on the right if you want to kind of slim it down. And so I'm going to click on sensory. Now, I'll tell you my story on how this website actually helped save my child in gaining access to services in public education. So my child qualified for OT services in the medical. Insurance approved it. We knew that there were some delays in fine motor, and so he needed those services. Yet when he entered back into public education, they said that he didn't qualify in for OT services. And I knew something wasn't matching up. So my little mind was like, let me go on TSLAT and see what's going on. So I actually came on here and I clicked on the assessment, and I ignore everything up here. But if I scroll down to download PDF, it gave me a brief overview on what this actually will look like. And so it gave me insight. And then what I like about it too is you can click on here and it will take you over to the actual author page to where you can read more about it. What I learned through this as a parent and learning about the resources and what the actual evaluation was, is it was supposed to have my child viewed in 3 different areas. It was supposed to view my child in academic, community, and home. Well, he was only assessed in the school, in the academic area. And so his disability doesn't just happen while he's at school, it happens while he's at home and in the community. And public education is here to service our kids in all areas and setting them up for success in life. So I filed what's known as an IEE, which is the Independent Educational Evaluation at the district's expense, because they didn't do the in-depth evaluation that they should have done to identify my son's deficits, and so and gain access to those services for him. So again, that's just why it's so critical for us as parents to learn what these evaluations are and what they should be looking at and doing. So super great here. The other thing that I like on TSLAT is when you come under Target is interventions. And so when it comes to the state of Texas, when it comes to children with disabilities, we are supposed to be using what's known as evidence-based practices. And so it's better than research-based. So it's evidence-based means it's scientifically data-driven, right? So when you come on here, it's a great hub. It lists them all out. I believe there's about 37 from A to Z listed down here. But what I like about here again is that filter system. So you can go through and figure out what's best for your child. And so let's say you have a little guy, he's 3 years old, and he's lacking some social skills, communication. There's some behavior there, very low play skills, doesn't have school readiness skills, academics, and then that there's some developmental delays. We can click on adaptive here. And so now it's filtered it down to where there's 9 interventions found. So we can see that there's social narratives, some parent implementations, things here, and visual supports. One of my favorite things, visual supports. So if you click on view here, again, just ignore this whole page because it's mumble jumble. You want to go to download PDF. It's the easy to read, clear version of everything. It will tell you the brief description of what a visual support is. It will actually show you the matrix for each income age level. Again, I always believe that early intervention and the effect size really can happen at any age. So even if your child's over the age 22, I still believe early intervention can happen then. But this is just the effect size on from studies that they've done. So, and it will tell you all the research if you want to read all this stuff, which like we don't have time for, but we can come down here. So then down here, it tells you the direct steps for implementation. Now, as a parent, I love this. And when I was a teacher, each of my students actually had a binder, and in their binder, under one of the first tabs was their evidence-based practices. And I would print out these pages here. So if I had a new para come in or a substitute come in and they wanted to know more about how to access services in with that child, they had a direct like, oh, this child uses visual supports, and so they were able to read the exact steps on how to go through and do it. Now, there's more steps than just reading an actual like printout on what it is, but I'll take you to another website that kind of shows you more in depth what that looks like too. But you can actually go back onto TSLAT and have a great video library where if you want to learn about visual supports, I'm sure they have a bunch of videos on here on that as well. And then they also have online courses. It's really important to know that if your child is in public education, that you have access to all of these resources. So the state of Texas is so big. We have different regional service centers. There's 20 regional service centers in the state of Texas. If you're in Harris County, you're in Region 4. If you're up in the Conroe, Woodlands area where we're in Region 6. But you have access to every single region that you want to go to. My 2 favorite regions are Region 13 and Region 20. Region 13, because that's the hub site where they kind of house TSLAT and all the autism resources. They're there in Austin, so they're close to just keeping up to date with everything. And then Region 20, because that's the San Antonio area, and they have great resources on their website as well. But if you're a child and you want to go through any of these trainings, let's say you want to learn about executive functioning, you can click on that there and it takes you to Region 13 website. Now, when you click on this, you're going to have to register through their website. If you need access to these services, you need to get in contact with your special education department and have them sign you up as a parent or have you train. They can even train you saying, hey, there's some courses on Region 13 that I want to take as a parent. Can you help register me so that you have access to these free courses? So this is a super great thing for everybody to have access to. You can even contact Robin right here to go through and learn about those services. So when it comes to parent training and you're going through your child's like IEP meeting and they say, do you need any parent training? This is a great opportune time for you to already kind of know what training you're looking at. And I always kind of look at training, you want to match it to that evidence-based practice. Any training that I do as a parent for my child, I make it a requirement for my child's general education teacher, his special education teacher, case manager, teacher, and then even the campus administrator that sits in our IEP meeting. It's important that we also have our admin that's a head of our child's IEP attend these trainings, especially if they're the ones that are the your child's teacher's appraiser on that campus, because how else are they going to be held accountable for implementing this instruction if they're not aware of these interventions and of these teaching strategies that need to be done. It really is just building up that tribe. And the best part about all of it is this is pretty much all free. So really there's no overhead cost for districts to absorb. So really, really love TSLAT. It's a great website to get to play around and learn and know. One of my favorite other websites is Autism Internet Modules. And again, this just doesn't go in for autism, all disabilities. But when you come in here, you can see that there's a lot of different modules that you go through. And so let's say we were looking at visual supports earlier, right? And we had all the printout list. I can come down here to visual supports. I guess it won't let me open it up unless I log in, and I'm not logged in right now. But if I go in, what this website actually does, it's a really great guide. And I say it's like one of the best, like, when you take defensive driving and you can just kind of click, click, click through things, you can't do that on here. It gives you like a pre-test, a post-test. It gives you like a reading scenario, a video scenario, gives you all these great different learning strategies. So you actually learn about that evidence-based practice. And then it even gives you a huge hub of free resources. So let's say that you will have like a pre-made first then board or visual supports. It will all be readily available. And again, this is all completely free. You can earn CEs through this website if you purchased what they considered, I guess, tokens, but you really don't need that. I mean, just getting it and getting that training and getting it in for free is super great. This website here, I always joke around with parents that there is no parent handbook on, raising a child, especially one with disabilities. And if there is, don't buy it. But this is a great kind of hub for parents to go to through Autism Speaks. And they kind of listed out just all of their PDF hand guide books. Now, this is their general overview. So this is pretty much all in English, but they do have this in all major languages. So that's another great resource too, especially for teachers. But I think one of the things that helped me the most as a parent was this 100-day kit. That's actually one of the things when we went to Autism Community Network, they gave us our child's diagnosis, put it in a folder, a little bit about his ADOS and everything. And then they slipped in this 100-day kit. I didn't open the folder for a couple of days, but when I was ready to face it and read it, I read this and it actually helped me, and it actually helped my mother-in-law as well. I gave her a copy of that, and aside from her just not listening to me, she was like, oh, I read an article in here and it says, as a grandparent, I can do this to help support him. And I'm like, oh my gosh, like if you're going to listen to that, that's great, but I'm glad that she had that support through that. So there's that. So when it comes to family groups, Houston's super great. We know we have the ARC here that is just a fantastic resource and wealth of information. Other great groups that I really love to go in and support here is the Feet of Houston. And this is actually by Dr. Amy Wood. And so if you ever want to go in and learn more about ABA, and just go into different resources and providers for that, you can learn about all that here. And she even talks about the Medicaid waiver information. So Feet of Houston is a really great nonprofit to get to know. Another great nonprofit organization is Family to Family Network. They do a great job. MJ and Judy Blake are phenomenal at what they do in helping connect different services for families and staff. They're a really great guide just to go in and learn about different services in the Houston area. Disability Rights Texas. This is a really great support system, especially for those within like a secondary or even transitioning into adulthood. And what they're kind of known for in the disability community is really helping provide supports, especially when it comes to legal supports within the disability community. Our overall goal for our children with disabilities to have them fully integrated in a community setting. And so, what does that look like for them, and how do we access those services? So, they have a really great access of resources here. They also work in conjunction with several different universities with their law schools. So, if there's ever something of a legal issue that you need help with, they do have cases where you can call in and get free legal support as well. So, super great things to know about them with Disability Rights Texas. One of the best programs that I had as a parent was through the Texas Council of Developmental Disabilities, and that is their Texas Partners in Policy Making. I thought I knew so much as a special education teacher and being in healthcare. It wasn't until I went through this program I learned so much about the resources in the state of Texas, and really kind of learning how far behind we are when it comes to state resources. And so, in order to make an effective change, there typically has to be a law set in place. And so, how do we do that? And how do we advocate for laws? And how do we keep pushing bills for health and human services, and for mental health, and for public education? Everything's so important, and it comes down to funding. And so, when you look at a state's funding and a state's budget, when you look at public education and when you look at disability services, those are two areas that are very skewed down. And so it's very important for us to make that effective change. This is one of the best programs that anybody can go through. You can apply in the spring, and it is a free course. And I believe that the ARC has something similar to this now, to where it is an effective policymaking group. Ginger is now the ARC representative for the state of Texas, and I've got to advocate with her with Texas legislators and senators. And during last session, and she's a phenomenal person within the ARC community. So, um, last thing that I'm going to touch on here is one of our favorite topics, right? Is public education. So I'm going to briefly kind of just go over, and there are actually 5 links onto this, because I find that as a former special education teacher and as a parent, it's so much. There's just so much to it. So the TEA legal framework, remember when I was talking about earlier how the state of Texas has over 20 different regions? This is where you can actually click on the legal framework is run out through region 18, but you still have access to all those services here. And you can click on the procedural safeguards, the parent's guide, and the special education law. They have some great resources on here, but play around with this website. It's super fun. So if you click on this for special education rules, regulations, this is where you're going to find that beautiful 368-page document of laws. But it's a digital format. So what I always tell parents to do is you can hit Control F and you'll get that search bar on here. And let's say I'm looking up something about autism and I want to know where it's at. It's going to filter through, and you can see it's starting to highlight in through, and I can go through and see each of the laws. What I like about when I look at the laws here is I can know that federal laws will always trump state laws and then your local laws. That's just the totem pole that we go in for, following the law. And so it will list out what the federal regulation says, what our commissioner says, and then what our state law says. And so if you ever have a district say, well, we don't do that, well, it's a TA state law. So kind of have to do it. So it's really important to know what those laws are. If you ever get in a situation like that, there are definitely more resources to help you guide you through that. Because a lot of our documentations the state has for parents is written at a college graduate level with a lot of legal jargon that's hard to understand sometimes. This is one of my favorite things, and this is actually something from the ARC, and this is the IDEA Parent Manual. It does come in English and Spanish, and I really, really, really love it. I believe if you contact them, you can actually get a free color copy, but you can just download this or even have it digitally. And so it goes through and it really just breaks down a really good feel of what is the steps in the process when you sit into your child's IEP. I do like the online version because look, you can have your filter system here and search through everything. But it gives you great examples how to write a letter, how to document things in an IEP, what is ESY? Like it really breaks it down into those parent friendly terms. And so this is just a really great thing. If you're going into an IEP, you don't know what to expect, you definitely want to check out this resource. It's something that you want to get to know. Another great thing to know, especially if you have a child with autism, and I believe all children with disabilities should have access to these, is under the state of Texas, we follow what's known as the Autism Supplement, and it's a supplement into your child's IEP. And so you can learn more about that here side by side, what it looks like. There's, I believe, 11, is it 11 or 13? 11 different strategies that they're supposed to be following and that you can list out. You are part of your child's IEP, so you can advocate and have those listings put down. So when I go in my child's IEP meeting and we're talking about teaching strategies, well, we're going to be using this on evidence-based practices, and we're going to be listing out maybe visual supports, all those other fun things that I've learned through TSLAT, right? So that's a great support to have for that. Accommodation Central. This is a super great website, again, through TEA. And what it does is you can search any accommodation you can think of. I have a lot of friends that are self advocates, and I've asked them before, what is something that I need to do for my son that you didn't see done for you in school to help him? And they said to just think outside the box. Just because a school hasn't done it before, just because it hasn't been done before, don't think that it can't happen and it can't be an accommodation for your child. And so this is a great hub of resources here. You can go into, just click around and you will be shocked on all the resources they have on here. For academic need, again, they have everything listed, but you can filter it down. So let's say that your child is struggling in their electives class. What are some accommodations that you can look in for that? So you can go through with that. Or let's say that they're struggling in with reading. You can click through and find those accommodations. Now, when you come to something like spelling assistance, let's click on that so you can see what that looks like. It will give you a clear definition on what it is. And now, because this is done through the state of Texas, it even matches it as if you can use it on the STAR as well. So it tells you the direct steps on how to implement it. And then it will also tell you the TA document policy on it. And then if it's allowed in with the STAR online, and you can expand these and see exactly where this accommodation is applicable when it comes to state assessments. So I love Accommodation Central. It's super great. Just like how we had on the TSLAT website for that interventions, they even have an academic need and a functional need. So if you have a child that has that needs supports and accommodations with behavior and focusing, you can help filter down and look at found 8 accommodations here. So you can see what is peer tutoring. And so you can kind of see how that looks like, what it looks like. And sometimes too, they'll even have like a hub of resources where you can click on that too. So accommodations are super great. If it's one thing that you really want to know about special education in the state of Texas, please remember this website here. And this is SpedTex. 855 SpedTex. There's nothing like going and picking up the phone and being able to call and get a live person on the other line. And this is where you're going to get that resource. So SpedTex, I've used them as a parent, I've used them as a teacher, I've used them as an advocate. You can call them, pick up the phone. I would call them as a teacher and be like, hey, my administrator is saying this about a student. Are we allowed to do that? And they'd be like, absolutely not. They would email me back out the law and everything. And so I'd be like, okay, cool. I would call them as a parent and be like, hey, I know that we're in COVID right now, but should he still be receiving accommodations? Absolutely. Here's the state law on that. And they can email you any resources that you need over. They also do a super great job at breaking down just different resources as well. So they're a really great website to kind of go through and learn. So that's kind of it for everything. I'm going to brush through on everything that I get to do with my company at Cole. And so, being the Cole difference, we do provide autism resources guide and training. If you ever have a provider that would like to learn more, we're always happy to provide that service. Please check out our YouTube page, Cole Health. We house a lot of great videos, all our webinars that we do there. We do have monthly parent empowerment meetings. I like to call it parent empowerment because we're not grieving anything. We're really here to help support and build each other up. And then our BCBAs and our therapists provide free monthly webinar trainings that you can also find on our YouTube page. And another great thing about Cole is that even though we are a great early intervention component in pediatric therapy, we really are looking at disability advocacy throughout the lifespan for these children. And so it's just the honor and blessing to be with a company that has that vision and values with that. So, and here's my email, wendy.maurer@colehealth.com. Feel free to contact me anytime. My overall goal for today for each of you is if you learned one thing, please share it with another parent. All these resources were built for my tribe and from my parents, and I'm just so grateful to have each of them. And I appreciate each of you being here today. Thank you.
Wonderful. Thank you so much, Wendy. We've got lots of comments, just excellent presentation. Thanking you for all this valuable information. It truly is a wealth of information. Thank you so much.
Thank you.